thank you very much. And Kathy, thank you and congratulations. It's a great senior center, and we're lucky to have you as executive director, and really happy to be here. What a day out there. I mean, I almost didn't make it. I'm not kidding. I was driving up. It was so nice. I was a little late. I mean, we've had a lot of wet weather here. Barre's got hammered pretty good, but we're working on. We've got the disaster declaration for many of the other counties that will be coming, I'm sure, for Barre. But it's wonderful to be here. Beautiful Vermont day, and we're here to talk about something that's extraordinarily important, and that is Medicare and the prescription Part D drug program in Medicare that is so essential to so many Americans and so many Vermonters. We have 110,000 Vermonters who are on Medicare and depend on Medicare for health care. And the prescription drug program, Part D, is a critical component of that health care. And what is so wrong about the Part D program is that even though the government, the taxpayer, is the biggest purchaser of prescription drugs, as a large purchaser, it can't negotiate bulk price discounts. So we buy wholesale, but we pay retail. And that costs billions of dollars to the taxpayer, and that threatens Medicare, because those of us who deeply care about Medicare have to do everything possible to make it affordable and to make it efficient. All right? And you may remember the history of the Medicare Part D program, but when it was passed, the deal was made that the law would include a prohibition against negotiating bulk price discounts. So, think about it. You go into the local drugstore and you're going to buy 100 aspirin, and you can't go to the aisle and get 100 aspirin for less per aspirin than if you buy 5 aspirin. All right? None of us would do that because we're getting the benefit of bulk purchasing. And the current law prohibits the taxpayer from basically negotiating a bulk price discount. This is incredibly expensive. If we institute, this is the legislation I'm introducing with a colleague, a Republican colleague, to allow, in fact require, that we negotiate prescription drug prices, so that if we buy in bulk, we pay wholesale rather than retail. If we succeed in this, then that would save the taxpayer and the Medicare program $156 billion over 10 years. That's real money. And there's no excuse for not doing it. We all know that there are enormous budget pressures in Washington. And my view is that it's irresponsible for us not to save money where we can, particularly when doing so makes Medicare stronger, not weaker. It makes the taxpayer more solvent. So this is something that we can do and should do. And my effort to do it on a bipartisan basis is an effort to show that all of us care about Medicare and all of us care about the taxpayer. The VA program provides a prescription drug benefit. And in the VA program, they negotiate prices. And let me just give you an example. In the VA, they've been able to reduce prescription drug prices by 58%. A Families USA report found that the top 5 Medicare Part D insurers charge 58% higher than what's charged at the VA. The difference? VA negotiates, Medicare Part D is prohibited from negotiating. I'll give an example. In 2001, it goes back a ways, but it's the same thing. The average wholesale price for Cipro was $4.67 a dose. The federal supply schedule price, the VA price, $1.77. So which would you rather pay? We're pretty tight with our money in Vermont. And seniors, particularly on fixed incomes, are very tight with their money. So let's get the benefit of common sense price negotiation. We were able to pass this in the House last year. It didn't get through the Senate. It didn't become part of the health care bill. But now Congresswoman Emerson and I are reintroducing this legislation this year. The urgency for it, I think, is widely known. It's for those two reasons. One, to make Medicare more solvent and more solid, and it's also to save taxpayers money. So I really appreciate you hosting me here today as I announce the renewed effort to save over $160 billion for taxpayers in the next 10 years. And now I'd like to invite Greg Marshallman to say a few words from AARP, and then we've got Tom Davis, who's been a champion in Vermont for all things senior and all things good for many years. And, you know, it takes a lot to get him off the golf course on a day like today, and here he is. So, Greg, you want to go first?
Thank you, Congressman Welch. We obviously strongly support this legislation, and I've called for it for many years. It just doesn't, as the Congressman suggested, make any sense that we're not doing bulk purchasing on behalf of everybody in the Medicare program. It's hundreds of billions of dollars over time. What's even more important to know, however, is the drugs that people take the most and need the most were things like hypertension and heart disease and diabetes. Drugs that if we can get them at an affordable price into the hands of Vermont seniors quickly, at an affordable price, will make their lives, they will live much longer and they'll live much happier. And if they can't afford their drugs, they end up in emergency rooms, they end up with very expensive medical treatments. So a lot of the drugs we are talking about here are drugs to manage chronic diseases. And if they're not affordable and people can't afford to purchase them, we're talking about increasing healthcare costs by unimaginable amounts. So we're happy to stand here. We agree with everything that the Congressman said, and we look forward to making sure that we can get this bill through. I would also note that in a very contentious House of Representatives, we're thrilled that the Congressman is working with Republicans, and particularly Congresswoman Joanne Emerson of Missouri, on this legislation. We believe that good legislation and legislation that has a chance of making it through the House will be done this way, so we applaud that as well. And it's a pleasure to be here in Barre today. Thanks very much for having me.
Thank you. Tom Davis. Thank you, Tom.
Thanks, Greg. I'm delighted to hear that AARP does support the legislation. I don't know how anybody can read that legislation and not. They sent us a thing over the internet, and how you could not support this legislation. At any rate, I want to compliment Peter Welch, who I've known for longer than some of you have been alive, I think. Peter is a man of substance. He is, you know, we deplore many of our politicians, but Peter is a student. He's willing to pay the price, trying to work in a bipartisan way to pass something that really amounts to something, instead of grandstanding on something that nothing will happen. So I really want to compliment Peter. I want to compliment, and I want to say that the legislation is long overdue. A lot of our news outlets don't represent what's really going on, and people become brainwashed if they watch a certain channel too long, which I won't mention, and but everybody knows. Anyway, thank you for inviting me here. I represent the community of Vermont elders. I'm the president. I couldn't find anybody else. And we aggressively keep track of what's going on in Montpelier, and have had some successes there, as well as supporting what Congressman Welch and the rest of our delegation is doing. So thank you very much.
Okay, thank you. Thank you, Greg. Any questions? If there's any questions for the press?
When this was passed, I think the concern.
You mean Medicare Part D?
Yeah.
Originally, yes.
And this prohibition was very controversial, but the argument was that it was, you know, if you did anything out of the federal government's so big that you could drive the drug company profits into the ground. What about that? Did you worry about innovation being crushed by stripping so much of the profit out of the drug?
I don't. I mean, that innovation. No, I mean, innovation is important, and we have to have research and development. It turns out that the pharmaceutical companies are spending much more on advertising than they are on research. And in fact, I'd like to see them to start to spend more on research, and we can deal with that with research tax credits and by having a streamlined FDA process so they can get from here to there safely sooner rather than later. But the Medicare Part D was really a corrupt bargain because you got essentially legislation that added about 28 million customers. Now that's not bad if you're in a business and you get 28 million new customers. And then you said to the pharmaceutical companies, we'll pay you whatever you charge. So that's a prescription for a lot of taxpayer pain and a real threat to Medicare. We've also seen, by the way, that it is true. In the United States, we pay the highest prescription drug prices in the world. And a significant part of that is that there is no price negotiation. And you compare that to the VA where there is negotiation, the drug companies are doing fine. By the way, negotiation is a two-way street. It's not a dictate. It's not an imposition of our price, but it's a negotiation. And it's the same as you going into the local pharmacy and deciding you want to buy 100 in bulk and get a lower per unit price. So I think that drug companies will do fine with price negotiation. Yes, sir.
So what's changed since last time around, and how do you think that it'll make its way through the Senate?
Well, here's what has changed: the pain of the deficit and the budget challenges that we face are immense, and both Republicans and Democrats are working hard to try to get on a long-term fiscal plan that'll restore balance. And you just can't afford to be giving away money for nothing anywhere. So I think there's more willingness on the part of some of my Republican colleagues to find savings through price negotiation. This is real money. Make a dent in the deficit. $160 billion is real money. So that gives me some greater optimism about our prospects this year.
Does it have, even in the House, did it pass with bipartisan support last time?
It did have some bipartisan support. I think we'll get more this year, but it did pass in the House. But actually, I take that back. There was bipartisan support, but this was part of the health care bill. And it got deleted in the Senate. And it was if you remember last year I was on the Energy and Commerce Committee when we were considering health care. And I was the sponsor of this amendment, and we were successful passing it in the House as part of the overall health care bill. But that was dropped in the Senate.
And have you guys looked into what it might mean for prices for people who aren't on Medicare, if they might raise prices elsewhere?
We have not. We don't have authority over that directly. Right. So I don't have the answer to that.
Can I handle that real quick?
Yeah.
If you look at the history of pharmaceutical companies, particularly since former President Clinton proposed national health reform in the early 90s, when there's been a threat of any kind of price control put on the drug companies, you'll see those prices come down in an effort to say, well, we can behave, we can do this, no one needs to provide any regulatory authority of us. When they feel that that the political chances of them having happened, the prices will go back up again. There's absolutely no reason to believe that there is a link between negotiating for some 28 to 35 million Americans and in negotiating that will do anything to bring up prices elsewhere. And for people in Vermont that are employed and have a prescription drug benefit as a part of their plan, AARP is encouraging people, if you have a $5 or a $10, $15 copay, ask for the full receipts. Ask for what it would cost you if you were paying full retail. And then you can get a sense of the tens of thousands of people that don't have this coverage and the kind of choices that they have to make. This is an issue that's really about people more than it is about anything else.
Yes.
Peter, you say it would be a great savings for the deficit, but this kind of savings also makes the whole Medicare program much more viable.
That's right.
Doesn't it?
That's right.
So all that opposition should be paying attention.
No, you're exactly right, and I am a strong supporter of Medicare, and as a strong supporter of Medicare, I want to do everything possible to make it strong and sustainable, and obviously getting a negotiated price is going to help achieve that. But you know, we really do. We've got to seize an opportunity here. There's as you know, these fierce budget battles, and there's a big argument about government and what its role is. But you know what? People need health care, and Medicare is an extremely popular program. And the concern that folks have about the budget deficit is an opening for us to get price negotiation where they achieve the goal of saving money and we achieve the goal of strengthening Medicare. So it's a win-win. The taxpayers win and seniors who depend on Medicare also win.
How'd you build this alliance with the Congresswoman that's
Well, she's a great member. I've known her for since I first arrived, and I've always regarded her as an outstanding member. And the two of us got together, and this year we started the Affordable Drug Caucus. So we're literally getting other members of Congress to join together about how do we make drugs, medications, more affordable. And she's a bipartisan type of person and an excellent member of Congress. You know, there are a lot of good Republicans in Congress. A lot of what's happening is that at the leadership level, there are just these battles about everything. And at a certain point, we've just got to look at the issue and find out how we can do what needs to be done, like save money and make a program more sustainable. And it's the Vermont style. You know, it's the way we do it in Vermont. You know, in Vermont, we're about solving practical problems, not having big ideological battles, right? So that works, and that's the approach I'm taking. And I find that if I work with people in a practical, concrete way, we can find common ground.
Nancy, I would note, too, there are a lot of caucuses, both in the House and the Senate, on a range of issues, certainly a range that AARP cares deeply about. Very few come with a real bipartisan focus from the start, and we're very fortunate that Congressman Welch has done that on not just this issue, but others. With the polarization in the House, Congressman, at the top, we need these bipartisan working groups to come up with legislative solutions that will have a chance of passing the full House and moving to the Senate. This is enormously valuable to the process.
Well, thank you. If there's no other questions from the press, we'll hang out. And yes, sir. One last one.
My name is Dagny Hobb.
Oh, yeah, hi.
Chef
How are you?
Regional Coordinator. How are you?
Good.
I work with this every day, and one of the things that I hear from people, and I think it's justified, that Walmart and Hanford's have drug programs.
Right.
And they can get the same drugs that they can get from a Part D plan for $4 for a 30-day supply, and $10 or $11 for a 90-day supply. Additionally, and I have a little vignette for you, and I think it's something I'd like to read if you don't mind.
Sure.
Specific to an individual who has a $3,000 drug, who has multiple sclerosis, who cannot access or pay for her medications, which then forced me to look into patient assistance programs, and that might be for people who are unable to afford their meds, so it's a very good place to go. The client gave me permission to provide her name. Her name is Joanne McIntosh, and she was new to Medicare this year. She pays for medications out of pocket, but could not afford the cost of one medication. It's essential for her health and welfare. Without the medication, she would be at risk of immediate and irreparable harm. The client has MS, had been prescribed a medication called Paxone. She could not afford it because it was $3,000 a month. After various attempts to try to find a plan that would cover the medication, it was necessary to locate a chronic disease patient assistance program who would provide her with the same medication for $20 for 180-day supply, half a year. This is a medication that the client has to inject. She just learned from her physician that the manufacturer of the same medication developed an oral medication, and the cost of this medication is substantially more. They're stymied by this, and I am too. Why would an oral medication suddenly go from an injectable of $3,000 a month to more if it's an oral medication? And frankly, I see this every day.
Right.
So I just wanted to thank you very much.
No, thank you. Thank you. And, obviously, you start wondering whether the reason the change is made is to be able to impose a higher price. And, you see that there's a lot of issues with the drug companies where when their patent is coming up, they change the color of the pill and try to extend the patent. Or when there's a generic coming online, the name brand will buy that generic and basically keep it off the market. So there's an enormous amount of manipulation that goes on, and that is a stunning example, and thank you for bringing that to our attention. But we can do a lot with the simple legislation that allows a bulk purchaser to negotiate a bulk price. That's all it is. Very simple. Some of the easiest things to do can be the most significant. So we really believe there's no reason whatsoever to stand in the way of these savings. So thank you very much. Thank you for that comment. Appreciate it.
Thank you, Peter.
Thanks, Todd.